podcast Diabetically Speaking with SmartMove360, where we're talking about diabetes, life with diabetes, everything that can affect it or help you or give you some ideas. And we invite wonderful guests. Let's go. All right, all right. Welcome, everyone. Welcome back. Happy New Year. If you are just finding us, I'm happy that you found us because we are here to bring you information that is hard to find. And our guests are always wonderful people who are very helpful, who are very full of information. And we have only 30 minutes for it. So let's go. Today, we have our returning guest. Joanne was already once our guest, and we had great conversation back then. And I am happy that today she was able to join us again. Welcome, Joanne.
Hi, everybody. Thank you so much for having me once again, Arena. And thank you to everybody that is tuning in to at least listen to our topics that we're going to discuss today. I'm really excited to be here.
Absolutely, thank you. And I just wanted, since it's January, it's the second episode of this year, and we are going to discuss what people usually discuss in January, in the beginning of the year. We build the plans, we setting up the goals, we are mapping the how we are going to achieve those goals, and everything is always looking very achievable. And this is what the topic of discussion will be: how to keep it this way. So, Joanne, did you are working with people, you are working as a coach, and you're helping them to actually stay on track, right? How are you suggesting them? What approach you are suggesting people when they are planning their activities for certain period of time?
Um, well, that kind of actually looks different for everybody that I work with because we all are so unique and different that what might work for me in terms of providing me motivation and like that little nudge forward to keep going may not work for our neighbor down the street, and that has
Yes.
just a lot to do with personality. But one of the really really excellent things that I think that people can and should do if they're starting something new
Mm-hmm.
is to find a buddy. Find somebody who has the same issue or something similar that also wants to try something new, try something different, try to stay on track. And that way, the two of you together can be accountability partners. And when
Yes.
you're finding that your sense of motivation is kind of petering out and dwindling, or you're scared about what's next, you can talk to that buddy, and then they can talk to you, and you can share, the times where you struggled and what you did in that moment to get out of it. Or by sharing with that buddy, they can help you back away from that ledge, so to speak.
Definitely. Yes. I keep repeating it almost in every show. Diabetes is a team sport. You got to have somebody on your team. The more the merrier, but at least one person who will be sharing with you some part of their time, and even great if they have the goals similar to you, but just a body who will be checking on you and see how you're doing with your goals, right?
Mhm.
That's great suggestion. Thank you. So, okay, we found the body. We found someone that also has some goals for the year, health goals. How would you recommend people to approach this goal settings, because I may say, yes, I would like to run a marathon in May of this year. Me who never ran a marathon, me who really doing some walking time to time, I like, from logical standpoint, I understand this is not realistic. But what we see all the time, a lot of times people have um, set their goals sometimes too aggressively, and when they don't reach it in time, they say, "Oh, I'm a failure. I always fail." So and they get discouraged, and they will say, "I just will do whatever my doctor said." So, what will you say about this goal setting process?
That is a magical question. I have a lot to say about that, but I'm going to try to keep it as
I
concise as
know.
possible. But before I say what I think might help people get through, let me just touch on what I see happen. I see that, uh, people, when they're setting goals, and this is any kind of goals, a lot of times, especially right now during the first month of the year, where we're a brand new slate and we're really going to do it this time, we set too many goals at once, and then it
Yeah.
becomes overwhelming because maybe we really excel at like these two or three goals here, but these other ones we didn't do anything, and then we sit and think about that, and it creates a cycle of negative thinking, and then we just say, well, I'm just a total failure anyway, so I'm not even going to bother trying. Let me go to the bar, let me have some drinks, and let me open up that pack of Twinkies and cookies, and let me not go to the gym. So we just, it's a self-sabotaging move to set too many goals at once. um, the other thing that's really interesting is that when people decide they want to start a new goal, of either doing something or not doing something, they do it for January 1st, the whole New Year's resolutions. Scientific research has actually demonstrated that by day 19, that's
Tomorrow.
quitter's day. And isn't that funny that that's tomorrow and we're talking about this right now? And so,
Yeah.
hopefully, by the end of our discussion today, you will be reinforced with a renewed sense of commitment to just making, I would say, no more than 3 goals at any given point in time. Really, psychology studies, in the studying how we learn and how we retain information, 3 is really the maximum for the most amount of, I'm not going to forget these 3 things. I'm going to work on these
Yeah.
3 things. It's manageable. And if you think about it, even a stool or a chair has to have at least 3 legs to stand.
Yeah, listen, I never thought about it to compare, but it's a great comparison. Something to be sturdy, it has to have at least three, right? Well, when you have seven, it's too much to manage, and it will be not sturdy, it will be shaking. So three is a great number. Thank you. Perfect, perfect. Okay, okay. So we are finding some goals, and as you just mentioned it, not only the fact that people setting up the goals, too many of the goals, but also sometimes they're too aggressive, right? So, what would be the good approach to make sure that they are actually achievable, that they're not too aggressive? I mean, you have to challenge yourself, but not shut yourself down right away.
And this is interesting because, well, um, again, going back to the setting too many goals, and okay, so we've picked our goals. How do we, make sure that we're going to do them? Let's bring this into context, specifically with diabetes and the
Yes,
aggressiveness and the challenge, because as we know, diabetes is a very complex disease. Does not just
yes.
affect one area of the body. Some of us, when we get diagnosed, we're in really bad shape. Like, some of us get diagnosed when we're in a coma in the hospital, right? And that's
Mm-hmm.
terrible. And so there's a lot of
Yes,
stuff that has to be done pretty much right away to help fix our body. Well, we'll leave that part to the physicians and the care team. When we get home, or when we
Yes.
from the doctor, the hospital, whatever, we have to look at the list, and sometimes the list might have 10, 15 different things we're supposed to do. Let's start low and slow and go with the top three. So in diabetes, the first thing you can make sure that you are doing to get yourself on the path to health is making sure you are consistently checking your blood sugar and writing that down in either a notebook or putting it in an app on your phone or using some other tool to record that blood sugar, because we cannot manage what we don't measure. We can't know if the medications we've been given are working, or if our dietary changes are working, or if the exercise routine we've started is working, unless we can see the direct benefits by checking our number on a consistent basis.
Yes. That's a that's a great idea, and I'm very often are talking when we're talking with people. They say, "Yeah, my blood sugar is okay," and then you ask them how often do they check it. Well, about once a week, uh, just fasting blood sugar. This is not exactly. It's it's kind of like staying afloat approach. It's not improving, because if this is the only time when you're measuring it, right, you have no idea what is triggering your blood sugar levels, right? What is actually tolerable and what is really you shouldn't be standing nearby, right?
Yeah, I had this conversation literally last week. Somebody in one of the diabetes groups posted that they had researched something and they thought they were eating too much of it, and something that I think that was like high fat. And my response was, "Well, have you been checking your blood sugar? What does your blood sugar number tell you?" And the person replied back to me as, "Oh, I don't need to check my blood sugar. I'm diet controlled. I was just wondering if this was too much." And I'm like, hold on a second. Diet controlled and not checking your blood sugar are not interchangeable. They don't have a relationship to each other. You will not
Exactly.
know if that food substance or drink substance or situation that you were in is affecting you unless you're actually checking your number. And the impact of those different things can affect you literally within minutes. Some forms of carbohydrates can literally convert to glucose in 6 minutes after you swallow it. That's how quickly it can
Wow.
happen. So we've got to be
Wow.
consistent.
Yes, and it's interesting because a lot of times people trying to do the control, right, but not knowing where they started, not knowing where did they get. How would you know if you are in
And
control?
you just brought up an excellent point by saying where you started. Because a lot of times when we're going through this, we don't see the immediate effects on a day-to-day basis, because a lot of us have been
Yes,
we're so used to feeling so bad for so long, it doesn't get better overnight, right? But if we forget our starting point, when we start to get tired and we start to get weary and we start to get like kind of just over this, we have no way to see how far we've actually come. And being able to look at where we were, where we started, and where we are today when we feel like giving up, that can change your perspective within a matter of minutes if you just think about it. Trust me, I know this from personal experience very recently.
definitely. This is very good point. I agree with you, because we have this conversation very often in a group in this diabetes 101 for beginners, when somebody will say, I started with this big number. I brought it to, say, started with 11. I'm right now 7. And it's just not going anywhere. And it's already 3 months how I'm working with it. I feel like I'm failure. I feel like nothing is working for me. Fortunately, we have a great group. Fortunately, people actually read posts like that and they jumping on saying, hold on, you just said that you lowered your numbers that much. And if today or this week your numbers are not improving, or you're not feeling too good, it may be because you improved too fast and your body is getting used to these numbers before your next drop in numbers. So this is a great point here, that we got to know the difference and remember how far we've gone. And it's not only about diabetes. Somebody learning to run, how to do some training, and they start with just being able to walk to mailbox and back, and then they could do it to mailbox and around the house, and then with the consistent training or just continuing doing that, suddenly a month later they could go 3 times around the house, and then in the half a year they could go for good solid 30 minutes brisk walking, and then they see somebody is running passing by and they say, oh my god, I will never be able to run, I am such a weak person. But listen, just half a year ago the only thing you could do was walking to your mailbox and come back and be worn out. Now you have 30 minutes brisk walking. This is huge movement, but we kind of forgetting about it, right?
I am living that right now. Because some people may or may not know, I was in a terrible, terrible car accident, and I'm still to this day absolutely amazed that I survived. And
Uh-huh.
I went from just being my normal, like kind of a little angry self and just kind of, it's another day, And then I had this car accident, and I woke up in the hospital and I was like, what's all this? What's going on? And I couldn't move because I had multiple fractures and a brain bleed, and I tore the artery in my neck. I was not allowed to get up out of bed. And little by little, I had to say, today your goal is going to be to move your feet. Today your goal is going to be swing your legs over the side of the bed and just practice sitting. And then it
Uh-huh.
came time to actually get out of bed and work with a physical therapist. And I went from being completely confined to the bed to 22 days later at home, moving around in my house, cooking like I own a restaurant, and being on this podcast here today. So if I can do it, if I can go from almost being dead to this with just a little bit of help, everybody watching today can take control of their health. I would say, if I may, I guess my final suggestion on, because I always say three and I've already given two, my final suggestion
Yeah.
is for you to really think about your why. Why do you care about having diabetes? Why do you care about fixing it? And take that why and post it somewhere where you can see it every day. Put it on your bathroom mirror, put it on the steering wheel of your car, put it inside your wallet or your purse or on the back of your phone, or put it somewhere where you can see it and remember it. Because when you can identify a why, that will help you have an emotional attachment to accomplishing that goal. And when you can get your emotions on board and stop being angry and resistant, you will be absolutely amazed at how much progress you can make.
Perfect. You this is the tool that I was looking for when I said what helps people to stay motivated. This is something that definitely helps to know your why and be reminded about why you want to get healthier, why you want to get control over your health and not just survive consequences of whatever actions happened in the past. It's in the past.
Yeah,
We are now here. So let's get in charge and take control and steer the wheel and know what we are doing and why. Right?
absolutely.
Okay. Okay, now there is one more thing that I wanted to talk today about, and that is for me is exciting because I know a lot of people And I know a lot of people, my personal people who I know, not about those people, but people who I know. Um, there are a lot of people who write the books, but I don't know them. And here you are, you just actually published the book that could be useful for our people who are diagnosed with diabetes. I'm saying our people, I'm talking about our Facebook group, Diabetes 101 for Beginners, but anyone who just learned that their relative got diagnosed with type 2 diabetes, or themselves, or they just want to stay away from this diagnosis as far as it possible. So tell us about your book a little bit. You don't have much time, but please tell me, why did you decide to write this book?
Okay.
How it could be useful?
Uh, all right. So to answer the first part of that question, I decided to write this book because I have been told for um, almost 2 decades that I should be a writer. That's one reason.
Okay.
But I decided to write this specific book, which is Diabetes 101 Playbook Journal for newly diagnosed patients, because I have been working in healthcare for almost 3 decades, believe it or not. I know I look too young, but really. And my aunt was diabetic. One of my best friends when I was a young child was diabetic. One of my best friends as an adult was diabetic. One of my patients' kids was diabetic, and my husband was diagnosed with type 2 diabetes in 2012. And because I am the way that I am, I had to start researching everything. I had to learn and understand everything about diabetes so that I could discuss with the healthcare providers on their level to make sure that they understood exactly what we had going on and what was going on, and that we understood exactly what we were supposed to do. And as I got into health coaching after I did nursing for a while and stuff like that, I started seeing the need for this book. I would hear from healthcare providers, well, I don't have time to tell them that. Diabetes isn't the
Mhm.
only condition I treat. I have 300 other patients. And I'm like, but that's not an excuse. But okay, so all right, so you don't have time. How about write some handouts for them? Well, I've seen the handouts and they're atrocious. You can't really make a lot of sense of them because they use complex clinical language on the one hand, and then on the other hand talk to you like you're a toddler. So the
Yes.
handouts don't make sense, and they just seem dry and like not personable or whatever. And then I started seeing a lot of very conflicting information online that if you
Yes.
don't have the clinical experience and education that I have or someone similar to me has, you can't make heads or tails of which direction to go. You've got people arguing
Mhm.
carnivore diet, people arguing plant-based diet, people arguing just take the insulin, and all kinds of different stuff. And so what I wanted to do was provide a resource that if you're a physician and you don't have time, you hand your patients this book or direct them to get it. And if you're a patient and your doctor didn't tell you anything, you called their office 5 times, they haven't called you back or told you anything, you can pick this book up and find a basic starting place that is not going to hurt you. It's not going to put you at risk. It's going to give you all the very basic tools and the explanations for why they're important. Plus, you can track your blood sugar number and how your body feels for 100 days. And then you can bring the book, which is here. Ooh, I don't know, it's not showing up good on the thing. You can bring this book to your healthcare providers and say, look, I've been keeping track of my stuff. Oh, by the way, there's several different sample meal plans, doctor. Which one would you like me to follow? Doctor, how about you write what you want to see my blood sugar number be at? And that way you have this as a reference tool, and you'll learn a whole lot. There are um, lots of links in here where you just take a picture and put your phone camera up, and it'll scan the QR code and bring you directly to the reference source so you can read for yourself some of the things that I've listed in here. We've got explanations on the different healthcare providers you might need to manage diabetes, and then what to do if you're sick, or maybe you need to go to the hospital. It gives all kinds of instructions about that, plus recipes that I have made myself. I've tested them. They're diabetic friendly and delicious. That's the book in a nutshell.
Absolutely. Thank you. And Joanne, I just did put on the captions here.
I see that.
So for those people who are watching this podcast, they could actually copy and paste. We will put the link also under the podcast in the comments. And for those who is listening, can you please tell exactly what is the name for your book so they could go on Amazon and find it?
Okay, so the name of the book, just go into your Amazon and put in Diabetes 101 Playbook Journal.
Okay. Diabetes 101 Playbook
That's
Journal.
it.
And that's the way how they, and of course you could always go to comments in our for our show and copy it from there. But if you are driving and don't know how to memorize it without getting into the accident that we don't want to happen. Well, Joanne, this is great conversation we had. Another great conversation we had. I appreciate you coming in. I'm happy that you survived your accident. This is, it was like scary thing to read when you posted about it. I'm glad that you are okay. I'm glad that you are 22 days to come back from condition you was in is a great thing, and it also shows here an example that mindset and determination can do a lot of things, and that's something that we all got to keep in mind when we are setting the goals and working on them and sometimes get discouraged. We got to continue working on it. Well, I need to make a couple announcements here, actually more than couple. One thing I wanted to let everybody know that our next Diabetic Healthcare Expo is coming up. It will be on Saturday, February 24th, last Saturday of the February. As always, we will go 10 a.m. to 4 p.m. Eastern Time. We will have 19 speakers talking about life with diabetes and stress management and support systems and everything in between with the cooking show in the middle. So mark your calendar and come join us. Very soon, I think at the end of January, we will start having on Mondays those motivational Mondays shows with the Monica Henderson that will have information for you to how you can stay motivated during the week. And Monica will be sharing with you tips and tricks and help you to get in the mood. Of course, on Tuesdays, we have our Telenurse Tuesday. It's not a show, it's an event when during the day you can post your questions for a nurse, and our nurses are coming later in the day from 7 to 8 p.m. and they go over all your questions and they answer them. And you could also connect to them if you want to discuss something in private. We always have a link how you can connect with those nurses. On Wednesdays, we have our support group meetings. Not every Wednesday, every other Wednesday. So we just had one yesterday. The next one will be on January 31st. And then you can count from there, or you could go to our group, Diabetes 101 for Beginners, and check when is the next support group meeting going to happen. And yes, on Thursday, every Thursday at 4 p.m. Eastern Standard Time, we have our Diabetically Speaking with SmartMove360 podcast, and we go live into the many of channels that I am a member of, and also it will be available on the Spotify and many other platforms where you prefer to listen the podcast. On Friday, we have our coach Trevor Brown. He is hosting the Fitness Fridays little sessions. I think starting this week, we will do it at 9 a.m. Eastern Standard Time. So 15 minutes of motivation and information from Trevor will be a great thing. And I also wanted to let you know that this show and all other events are happening because of our sponsors. It's Mink Life Motivation, it's On Balance Entertainment, it's Life Based Solutions, and Empower People That Care. These are our sponsors, and thanks to them, we continue doing what we are doing. With that, I would like to see how I am closing that. With that, I wanted to say again, thank you, Joanne, for joining me today for the podcast, sharing your information. I think people learned a thing or two today. And if you caught it at the very end, just play the replay and do it again and collect the links and see maybe that book will be the last little brick in your wall that you are building uh, towards your healthy life. With that, I will wrapping up. I will see you next Thursday. And for now, please have a great end of the week.